Hi, everybody. Thank you for joining the midday download today, brought to you by CAQH. Today, we will be talking about credentialing providers amid a pandemic. Next slide. So the speakers today are going to be myself. My name is Warren Chang. I am a Senior Business Development Manager here at CAQH. You can also see my email above. Alongside with me is James Morey, Senior Management of Implementations at CAQH. Next slide. So a little bit of background and logistics for today. Today's session is being recorded. All attendees will receive a link to view the on-demand webinars. Your phone will be muted upon entry and during the webinar. Throughout the session, if you have a question, you may communicate through the portal. Questions about CAQH can be directed to CAQH via the question panel on the right side of the GoToWebinar desktop. Next slide. So who we are. Next slide. So for those of us that know us, and some of you guys probably already know a little bit of background about us, CAQH is a nonprofit alliance of health plan and trade associations. Everyone that you see here on the slide sits on the board with us, helps us develop the solutions that we bring out into the market. We consider ourselves sort of like a Switzerland. Anthem, Aetna, a couple of the Blues, Centene come together and address industry pain points, and we help develop the solutions that we bring out into the market. Next slide. From the challenges. Next slide. So due to obviously kind of the new normal, COVID has obviously disrupted a lot of our day-to-day activities. Here at CAQH, we are no different. I'm currently working from home, as most of you are too. To address those kind of new realities of working from home, childcare, these are all things that we really didn't have to think about before, but certainly now we have to face. Next slide. On top of that, we still have we also have our primary source verification processing challenges. So working with our member plans and our kind of regional plans, we've developed kind of a few main concerns that plans have given to us: data accuracy, turnaround time, a lack of insight into what's happening to the primary source verification process once a file is submitted, problems managing credentialing volume shifts, chase work, and inconsistent sanctions monitoring. Next slide. So how our healthcare organizations are addressing these challenges. Next slide. So if you take a look at the screen, you can see that based on what's happening today, health plans have to do a lot to kind of figure out what they need to do, how to calculate the budgets, make the teams work together. And for the main purpose of this call, we're also discussing how you can consider outsourcing and seeking external support. Next slide. So I know the font's a little bit difficult here to read, but what we're trying to show you here, right, is some of the main things to consider when considering outsource is the credentialing cycle. What's the turnaround time? Currently, we're offering a 14-day or less turnaround time, but you also want to know about the completeness and accuracy of the report, what your staff management is, and also cost. Next slide. How we alleviate the burden for healthcare organizations. Next slide. So right now, this is kind of an overview of the solution. Many of you guys are probably familiar with our ProView solution. Verified actually sits on top of that solution. 86% of our primary sources are automatically queried, and we also have a direct connection with the ProView application. So some main things about our solution: 95% of our files are completed within the first 14 days. We do have a 98.5 accuracy and complete rate while providing the insight into what's happening into the process. When I talk about that 14-day turnaround time, I want to be clear that that's not based on a complete file. We're turning around that file 14 days from the request. So we're also working through weekends as well. The main issue here is that we want to get rid of a manual process. Manual process slows down turnaround time and also opens up for a lot of manual mistakes. That's the main reason why we're running it and checking it directly from the ProView application. Next slide. So as you guys know, the product is built on top of our ProView platform. ProView's been around since 2002, and providers are very knowledgeable about this solution. We have 1.6 million providers that are currently housed within the solution and over 1,000 participating organizations. Providers log back in every 120 days to reattest the data. And since we built this solution, Many of the plans that have been using ProView asked us, why don't we check the provider application to do the verification, which is why we launched the verified solution. Next slide. So the automated process is an important piece of the process when it comes to primary source verification. On the left-hand side, the providers are logging in through the ProView portal, filling out the credentialing application. That's immediately pulled to the primary source verification field. And again, for those 14% of sources that aren't automatically queried, we do have a manual team go out and pull those checks. We automated everywhere we could so that you guys could get to a decision quicker and faster without a manual process. On the back end side, for each of the data elements, we have a content categorization scoring, kind of an A through Z content categorization scoring, so that you guys can quickly get to a decision. If you guys are interested in learning more about that, we can set up a call, set up a meeting, and actually demo how that categorization scoring works and how that will look like for you. At the end of it, all that data will feed into a provided data management solution that you currently have, so you guys can quickly get to a decision. Next slide. This is going to pass to James. Thank you.
All right. Thanks for that, Warren. So within this slide, we're going to talk about how the process itself is being simplified by using the verified system. So as Warren had mentioned, with the integration of verified with ProView, we're able to integrate a lot of the data that's being passed between both systems. And ultimately what we're trying to do is also make it simple for the health plans to use the service. So within this slide, you get two different views, one from the health plan perspective and the other one from the CQH. And what you'll see is where your process now gets simplified by using verified, and how CQH is going to take on most of the burden of capturing the information, delivering the output. So in the first section here across for the health plan responsibilities, you could see from your view, you're pretty much going to be submitting a roster that's going to identify which providers you want to be able to credential, and also defining, what kind of credentialing type it's going to be. Is it a net new initial credentialing, or you can even future schedule reappointments. From there, from the CQH view, which is the bottom row, we will then take that request, we'll move forward, and we're going to start data collecting of the provider information from ProView. We're going to start applying our automated rules logic, and this is the automation that Warren was talking about, where we can go check the data that comes out of ProView and identifying if the data meets all the conditions for delivery, or is there data elements that we need to outreach for in order to be able to capture from the provider themselves. So those are going to be the processes that we'll conduct on our side in terms of reaching out to the provider, via phone or email, to be able to get additional information from them, or capture the required information in order for us to be able to complete the profile. Then when we do deliver the work back to you as an organization, this is where you're going to be able to take it and load it into your PDM as Warren had mentioned, and we would start looking at you applying automated rules around that. Because ultimately, at the end of the day, the ROI that you're going to get from the system is going to be, how much of the manual touches that you have to do with the provider information that you receive from Verified. So the data categorization helps you be able to build that knowledge workflow around that, so that way your team members is able to really only focus on the providers that do need attention, where the others that did meet the validation at the highest level through Verified can automatically pass to your committee review. Then at that point, eventually, again, you're going to automate all the data load into your PDM process. Okay, next slide. And Warren, I'll pass it back to you.
Okay, thank you, James. So when dealing with, when talking to our clients, and these are the kind of our regional and national plans, managing credentialing volume shifts is kind of a big hurdle. So, I know that a few of you probably have your own in-house credentialing team. You guys may be using a CVO as well. Volume shift is never kind of consistent. If you guys take a look at the graph, you can see certain months have spikes in credentialing and certain months have lulls. And obviously, due to the coronavirus, it's also changed quite a bit. Credentialing teams have people that leave each year. They have people that get promoted, people that change career paths. And these all kind of play into volume shifts. And CAQH is happy to take on that volume that you guys have, specifically for overflow. So certain months, if you guys are kind of kind of smooth and there isn't really a credentialing problem, there's no problem. You don't have to send us any volume. But if all of a sudden, if you do see a spike and your team isn't where it needs to be, you guys can offload that volume to us. We're happy to take on those volume shifts to help kind of smooth out the process for you and make that credentialing transition easier for you during the time if your team's not there. Another metric that credentialing teams have is they have monthly volume goals. We've talked to credentialing teams that need to run, 500 to 600 files a month, or if not more. For that process, we can help take on half the work or all the work if needed, just so you can meet your goals. The good thing about CAQH is that we do have SLAs around our turnaround time, so that you can always be sure that if you send a file to us, we can quickly turn around that information and get it back to you. Next slide, please. So chase work. This is another problem when it comes to credentialing as well. Getting a complete application, making phone calls, outreaching to the provider. These are all pain points for the credentialing team when they want to chase an application. We know that the credentialing application in ProView isn't always complete. ProView obviously will do outreach, so we'll reach out to a provider if they have an expired or an incomplete application, but Verify will also do outreach as well. We'll make at least two emails and one phone call to make sure that the provider does get complete. The goal here is CAQH wants to make the credentialing team's job easier, and we know that chasing an incomplete application and getting the provider to upload those documentations can be a pain and slow process. The providers are all well aware of who CAQH is, and they understand who we are, so they're likely to be engaged with our solution. Next slide. Finally, this is going to talk to a little bit about our pricing. So when you use Verified versus a different CVO, we don't charge any pass-through costs. Fees to access MPVB, AMA, ABMS, National Student Clearinghouse, these typically are what we call add-ons and pass-throughs. When you purchase the Verified solution, the price that you get is the price that you have. We don't charge you extra pass-through costs. Another main kind of cost-saving solution is going to be that ProView data. As you guys are all aware, for every provider that you do roster on your roster, it's $5.28 per provider per year. And that can add up quite a bit if you have a large roster. For every provider that you do send through our Verified solution, not only will we kind of eat all the pass-through costs, but we'll also eat the ProView data for 3 years. Outreach via phone and email is also going to be included as well. Okay, next slide. I'm going to pass this to James.
All right, so in this next session, we're going to talk about how we can, or how Verified can be implemented in 3 weeks or less. Next slide. So in our standard timeline, this is what we would normally see with most new organizations that are coming in that are wanting to use the service. So from our kickoff process where we talk about what to expect and the coordination of the implementation timeline, to the point of go live, it can take anywhere between 3 weeks or more depending on how fast the organization is able to move, as well as what we can do in terms of truncating the time. Obviously, this timeline is adjustable. So as we are working with the organizations, we're able to throttle up or throttle down if need be. But the idea is that we're moving at the organizational pace in order for them to have a good experience in terms of implementing and being able to go forward with the process on their own after go live. Next slide, please. In the truncated implementation timeline, and this is where we try to be as aggressive as we can within the implementation. Here we're going to be working with organizations that are wanting to really just kind of hit the gas full speed and want to be able to start right out of the gate. So in this scenario, what we're doing is we're bypassing a lot of the training that would go in as part of the front load implementation process. We're actually going to take whatever backlog or whatever providers that they're wanting to be able to start doing the credentialing for now, and CAQH will assist as part of the load process. So what we do is we accelerate the go live by being able to take on some of the work that would normally be done from the health plan's perspective. And what this does is allows us to be able to compress that timeline even more, where you get to go live faster, but you also get to see a lot of your real world data that's coming back from the system, be able to use that as part of the training, and in essence, give you hands-on experience as part of the training process in itself. So instead of looking at sample files, we're using live data, so that way, one, you can avoid any type of gaps between what you were doing previously before to who you need to be able to get through the system now. You can start on those right away, and also give a good experience within your team, so that way they can easily see how the system is being used and what are the options that are available to them. So we have the two different models that we can utilize, where if someone does want to do a more traditional implementation, we have that, or if they wanted to go, a truncated version of that and start as fast as they can, we have that option available as well. Next slide. Okay, Warren, I'll turn it back over to you.
Thank you, James. Next slide, please. So this summarizes kind of what we believe and how we can help health plans kind of get up and running through this current pandemic. Obviously, we're experiencing an error rate of less than 1%, so 99% of our clients are complete, our files are complete and current. We can compress the enrollment time, so get you up and running fairly quickly. We're going to reduce the data entry and manual effort, so the files are going to be automatically pulled from ProView. The sources are automatically queried, so you can get a quick turnaround time, all achieved at a lower cost. And on top of that, we do have a sanction monitoring solution on the background that can monitor state licensing boards, OPM and OIG, Medicare and Med exclusions, and SAM to know. So if your provider does have a sanction, you guys can be aware of it. And that's going to be the credentialing suite from the front end to the back end. Next slide. Questions. So now is the time to ask questions. If you do have a question, please, on the upper right-hand side, type in your question. We can help answer those questions for you. James, are you seeing any questions?
Yep. I was going to say, we did just receive a question about the automated process itself. So question is, do you have to be fully automated, as part of the load process up front, or can you transition from a manual process into an automated? And this is a great question, because a lot of organizations move at different speeds. If you are looking to be able to fully automate something within your side, you do want to be able to get some time to be able to use the data, be able to fully understand that, especially from a credentialing standpoint. You want to be able to build a process out that's going to work for you and your team, and where you can fully recognize the ROI opportunities. So for a lot of groups that have gone through an automated process, they have started with a manual process in the beginning, where they'll start manually getting information in, and they're using the experiences and how the data is being presented to them to be able to go through and be able to build a better process on their side before they make that financial commitment. What's good about that opportunity too as well is we have reporting that's available through Verified that will help organizations still receive some of the benefits of an automation. So as I mentioned before, there's the ability to quickly identify providers that need analyst work up front versus having to go through all the content by itself. So as organizations will automate that from a knowledge workflow, we do have reporting to be able to help those manual clients be able to get to some of those answers a little bit quicker as well. So we do have some variation there that organizations can take advantage of, even though they're not ready to go automated right out of the gate.
Thank you, James. I got a question about pricing. So for anybody interested in pricing, we do have pricing is dependent on volume. So if you are interested in learning about what pricing is, please email me separately at wchang@caqh.org, and we can kind of talk through what your typical annual volume, recred volume is, and what that would look like for you. I'd also like to let you guys know that please don't forget to download the document that is found under handouts. It should be showing up in your interface.
Hey Warren, I got another question around the delivery timeframe for the 11 to 14 days for work that's being processed. So the question is really around, does it really take 14 days for work to be delivered back to the organization once it's been requested? So that's a good question, because how Verified is built is, as we go through and we're loading provider data and we're taking it through the automated processes, obviously we're trying to have a workflow that's built on speed and accuracy. So what's going to happen is, as we are looking at the provider's ProView application, if the provider meets all the conditions where there's no additional data that we need on it, where there's not a deficiency or something that we would have to reach out to the provider on, we would actually take that work and deliver it to you right away. So, as we talked about the 11 to 14 day time cycle, we do have an opportunity based on the provider data to deliver that within a 4 to 5 calendar day timeline, again, based off of how the provider answers their information. So, we got quite a few providers that do fit within that condition that we've seen over the years, as providers are coming in and retesting to their data, and the information is accurate. At that point, as requests are coming in, we're making sure that, depending on how it's being requested, that if we can give it to you within a matter of days, we're going to do that. And the only time that we're really going to run to the full cycle is if we are actively pursuing something from a provider and need them to be able to update that in order for us to complete the file for you.
Okay, I'm seeing a question next. Thanks, James. Is there any minimum number of providers I'll need to credential to use your service? I think I touched on this earlier, but I'll repeat it again. This is a no. You can use this as much or as little as needed. There are no minimums. Many of the plans right now are sending overflow to us. So certain months they'll send us 100 to 300 to maybe 1,000 files, and then for a couple months after that, send us nothing. We're here to kind of take on the volume that you guys need to send, so we can help you offload those overflow files and help you kind of get to a current status. James, are you seeing any other questions?
Yeah, I think I see one more in terms of, should we submit all credentialing volume now or load as we go? And this is more of a utilization question, is what it looks like. So in this case, like we have, in credentialing, there's two types of credentialing that's out there. There is the initial credentialing, net new provider into a network, and there's also the reappointments. After you have credentialed that person, you have that 3-year cycle that's going to be, in the future, that at that point you're going to have to take them back through to reevaluate their data. In this scenario, what we do is we work with a lot of organizations where it's, if you're bringing providers into the first time within CEQH, you don't have to submit them as initial credentialing, if these are ones that are reappointments on your side. So that's a very common question that we get is, does everybody have to be net new with you? And the answer is no. The ones that we would recommend taking through initial credentialing are those providers that are going through contracting with you and being looked at for the very first time. So, in that case, you can request them, and when we deliver the information for you back to you, we will automatically queue that individual for the future at a 3-year appointment further down the road. Everybody else, if these are reappointment volumes, the great news about Verified is you can front load all that during implementation for the next 3 years, because most organizations already know who the providers are and when their reappointment dates are going to be set for that future time frame. So it's a great way, as you go through the learning process, you have the additional resources available to you that can be able to help get that data loaded in. Then at that point, you're just managing, your provider network for anybody who doesn't need to be credentialed at that point. So we do support a front load, as well as, you have the option to be able to request both initial credentialing as well as reappointments.
Thank you, James. I think we can go to the last slide. Okay, well, thank you. This concludes today's session. Remember, if you're interested in learning more of methods about improving your credentialing speed or PSV data accuracy, feel free to contact James and I. Our contact information is on the screen. And thank you again for joining the discussion.